Live look at the White House right now, where officials are tracking a dozen cities after a concerning jump in COVID-19 cases. San Jose is one of them. However, the mayor says that is news to him. KPX 5's Devin Fehely is live in San Jose with the latest on this. Devin.
Yeah, by virtually every measure, the numbers are going up, and that is just not a good thing. But we are a long way from the nightmare scenario in which there are too many sick people and too few hospital beds, nurses, and doctors to care for them.
Certainly, I'm very concerned about what's going on in Santa Clara County. I do think we have an uptick that we are very challenged by.
Dr. Jeff Smith, the Chief Executive Officer for Santa Clara County, says cases, hospitalizations, and deaths are all climbing, threatening to undo the benefit of having been the first in the country to issue stay-at-home orders. 2 weeks ago, case numbers in the county were below 7,000, but have rocketed up past 8,500, a 26% increase.
The reality is that this contagion is spreading within families, in homes, and in social gatherings. And really, it's not so much what's happening at work, it's what's happening everywhere else.
Mayor Liccardo and Dr. Smith say they are both closely watching the number of people in the hospital, which typically spikes a few weeks after the new infections begin to climb. There's currently 175 patients in the hospital being treated for coronavirus. 2 weeks ago, that number had just inched past 100, a 66% increase. The good news is the healthcare system as a whole is not yet overtaxed. About 30% of the hospital beds countywide remain open.
Definitely trended down through the end of April, May, and June. We are seeing a second peak, but it doesn't seem to be quite as vicious.
There is one final sobering stat. The number of people dying from the disease is on the rise, climbing from 174 to 183 deaths in the past 2 weeks.
You may have noticed that the number of people who have died from the disease in the last couple of weeks has not risen as sharply as the number of new cases and hospitalizations. It's known as a lagging indicator because typically people get sick, they get tested, it takes a couple of weeks to land in the hospital, and then typically a couple more weeks before they die. So we'll have to watch those numbers of people that are dying in the next couple of weeks. In San Jose, Devin Fehely, KPIX 5.